Dear Susan, heartfelt congratulations. The floor is yours now.
Thank you. Thank you to you and to your colleagues for such very kind words. And this evening, what I'd like to do is to talk about how psychology is helping to tackle the COVID-19 pandemic. Worldwide, governments have asked people to change their behaviour to control the transmission of coronavirus. We've been asked to travel less, and as a result, I'm sadly not able to be with you in Istanbul to receive the prestigious Sakip Sabanci International Research Award. Thank you very much for honouring me in this way. We've also had to change other behaviours, keeping physical distance, wearing face masks, ventilating indoor spaces, isolating if we get COVID, getting vaccinated, washing our hands and cleaning surfaces. Psychologists have played a key role in understanding and changing behaviour to tackle COVID-19. Psychology is the scientific study of the human mind and of behaviour in given contexts. Psychological evidence and theory has enriched our understanding of how coronavirus is transmitted between people via their behaviours and how to break those behavioural pathways of transmission. I have been advising the UK government on how to achieve this, working with many other academic disciplines such as epidemiology, virology, anthropology, to ensure best advice. My discipline, psychology, has conducted studies across many countries that find that people are generally adhering to new rules about how we should behave. But it is important to understand when they are not. My research group has been working to understand why people might not stick to advice and rules. We've been using theoretical frameworks, and one that we've developed shown to be useful in many situations around the world, called COMBI. It explains that any behaviour, including adherence to rules, results from three general influences: the person's capability, do people have the knowledge and skills to do what has to be done, their opportunity, do they have the resources to do it, and their motivation, do they want or need to do it. So COMBI stands for capability, opportunity and motivation, and the B for behaviour. This is the simplest version. Of course, each of these components can be elaborated, rather like peeling off the layers of an onion. So people are on the whole motivated to do the right thing, if they think it will keep them and others safe, and if they are confident that they can do it. But they may have problems with capability, for example, remembering the rules in given situations, or with opportunity, for example, keeping physically distant from others in crowded neighbourhoods. An example of applying the COMBI model to COVID-19 comes from my own work, a weekly national survey of behaviour and their influences. This is informing the UK government's policy and communication. One of our findings has been that more than 50% of people with COVID symptoms are not self-isolating for the recommended period. The majority of people, even now, don't recognise the three main symptoms of COVID. And obviously, if you don't know you have COVID, you won't self-isolate. We also found that people with symptoms intended to self-isolate. They were motivated to do so, but when it came to it, many of those on low incomes, with precarious jobs and facing financial hardship didn't do so. This shows that this is mainly a problem, not of motivation, but of opportunity. People had to leave the house to go to work or to get food or medical provisions or for caring responsibilities outside the home. Understanding why people are not doing something is the first step in working out how best to enable people to change. Behaviours are influenced by other people's behaviours, so if we want to change the behaviours of citizens, we may want to achieve this by changing the behaviours of others. Health professionals, employers, policymakers and politicians. So, for example, if we want to encourage vaccination, in addition to targeting the behaviour of citizens, we should think about health professionals' communication, employers in allowing paid time off for staff to be vaccinated, and policymakers to ensure vaccinations are accessible locally in communities. Having identified what behaviours and whose, we then need to identify the most appropriate techniques to change behaviour. Our research group has identified 93 behaviour change techniques from the literature, and many of them are relevant in helping people protect themselves and others against COVID. Which techniques we use will depend on what would be appropriate for different populations and different settings and different behaviours, and whether the task is to change capability, opportunity, and/or motivation. So if our task was to increase self-isolation, we would not use techniques to increase motivation, such as threatening people with large fines, but instead use ones aimed at increasing opportunity, providing social, financial, and practical resources to support self-isolation. As well as theory, psychologists use evidence to propose how governments might achieve population-wide behaviour change. We have good evidence for many strategies. Here are 4 key areas. First of all, trusted leadership. Trust is earned by authorities in many ways, one of which is to be seen to be part of and serving the community, and to treat the public as a respected partner rather than as a problem. Secondly, communication must be honest, open, clear and transparent, and telling people not only what to do, but explaining why people need to adopt certain behaviours. Give them a rationale. Thirdly, fostering a sense of solidarity across society is very important. This helps people to stick to rules, even when difficult to do so. But building solidarity requires recognising the diversity of communities, young people, women, those on low incomes, ethnic minorities, and engaging with, consulting, listening to, and learning from them. Including these diverse communities in decision-making not only leads to better decisions, but also makes people feel part of decisions and therefore more likely to support them in practice. Fourthly, support and enable the population to adhere and avoid blame and punishment. Instead, recognise, reward and celebrate achievements of the population, especially disadvantaged communities who are adhering often in very challenging circumstances and with considerable sacrifice. COVID-19 has caused greatest harm to those already disadvantaged, those living in overcrowded housing, working in unsafe jobs, and those with a history of poverty that has already undermined their health. It is imperative that governments worldwide and other authorities implement policies to reduce these inequalities. Of course, governments don't always do what we psychologists and other scientists advise, but we always try to ensure the best advice. I hope that the government in Turkey is also benefiting from the advice of psychologists and other behavioural and social scientists in tackling COVID-19. What of the future? Building pandemic resilient societies for the future must include changing population-wide behaviours as well as reducing inequalities. There's a general consensus that we don't want to go back to normal. It was the old normal that made our societies vulnerable to the awful effects of this pandemic. We need to think big and different in how we organise our cities and our working and recreational lives, not only to protect ourselves from future pandemics, but to address an even more serious existential threat, the climate emergency. Other sciences are contributing enormously to understanding how the climate is changing and have been sounding the alarm for many years. As psychologists and behavioural and social scientists, we need to do our bit to addressing this emergency. We need to understand how we can get people and governments to change their practices and policies, what we eat, how we travel, the buildings we live and work in, sustainable businesses, agriculture, and consumption. We have tools. I've mentioned the COMBI model of behaviour and 93 behaviour change technique, but psychologists have a wealth of theoretical understanding, evidence, and methods they can apply to the big challenges we face. An important lesson from this pandemic is that no person, no community, and no country can protect itself on its own. We humans are all interconnected, and solutions must be global. We can only protect ourselves by protecting each other, whether this be COVID-19 or saving our species on this planet. Thank you again to the Sakip Sabanci family for the opportunity to be honoured with this award and also to learn something of the impressive Sabancı University and to be with you today. Thank you.